Hello, and welcome to the symplr Education Series webcast. Today's webcast is titled The Benefits of Enrollment with Donna Goestenkors and Donna Solis. This webcast is brought to you by symplr, Team Med Global, and Sonoma Credentialing. Next slide, please. And also MSP for the medical staff professional. I am so pleased to have Donna and Donna as our guest speakers this month, and I would love to turn it over to Miss Donna now.
Perfect. Thank you very much, Kelly. Hi, everyone. I'm happy to be joining you today to address a topic regarding why outsourcing enrollment may be the right decision for you and your organization, or at least help you understand how the medical staff services industry and healthcare in general is expanding toward remote work environments. I do have to apologize for my voice. Some of you may also participated in a webinar I did yesterday, and if you can tolerate the raspiness of my voice, I'll continue to push through. I have a lot of water sitting next to me, but I made it through the whole session yesterday, so I have confidence that we'll be able to make it through today as well. I do want to refer you to our previous slide again to say our same fabulous team of education partners are supporting today's webcast. Callie, who introduced the webinar, and the other folks at symplr, my colleagues and I at Team Med Global Consulting, Sonoma Credentialing Services, and all the wonderful MSPs who continue to support these complimentary educational webinars. Those of you may know me. I've been in the medical staff services field for over 40 years, and we really have had such a pleasure, Donna and I, bringing you an entire educational series on payor enrollment. And today's program really helps carry our listeners to a new plateau of opportunity and enrollment, and understanding in the enrollment field. It's now my pleasure to introduce you to my colleague, Donna Solis. Donna, how about one of your warm and friendly greetings to our listeners?
Thank you, Donna. Well, thank you for having me. I'm really happy to be here, and I'm happy to be talking about the benefits of outsourcing enrollment with everybody and sharing some of our insights and what we've learned over the years through working in this field. So thank you, Donna, and I hope that everybody enjoys our program.
Wonderful. Thanks, Donna. Well, what are Donna and I excited really about sharing with you today? We want to give you a global view of outsourcing trends in the United States, because I firmly believe before you can really make a decision, you have to understand what's going on around you, and this global view will really help put it in perspective. Donna and I also want to reinforce to you the impact effective credentialing and enrollment practices have on your organization and how you can be a true value master in your process. And then we want to describe the pros and cons of why one should or shouldn't consider outsourcing their enrollment function. But as we do with all of our programs, we really want to be focusing on outsourcing and ask you to really think about the possibility of outsourcing. And I know there may be many of our listeners who are a bit anxious with that concept even coming to them, and they're participating in this program because they want to know what kinds of things we would be discussing that might take their job away. But Donna and I truly, from our entire series that we've presented in anything we do, it's about supporting the role of the MSP, the credentialing specialists, and that enrollment specialist, and give them the tools that will make them be most effective. So really think about it with as open a mind as possible, because with every challenge, there is an opportunity, and the challenges are those that are around us, because the trends really are pointing to the direction of remote work. When we're thinking about outsourcing any project, we need to be aware and be introspective about what the reality is. As managers, owners of businesses, or the workers who are doing the day-to-day operations and practices of payor enrollment, we know that our administrators have decisions that they have to make in order to make certain they are fulfilling all of their financial obligations. So they have an opportunity to continue housing that enrollment function internally, be responsible for the control, the quality control of that product, the individuals who are performing that work, and the overall level of service that would be provided. And they hold that type of goal and principle and passion very close to their heart, and they may decide that no, we're going to maintain that internally because our process is just that good, and we're able to do it in a very cost-efficient manner. But the other reality choice is outsourcing that payor enrollment function. And as we move into the program, we will give you some of the reasons and the advantages and disadvantages that you need to be aware of if you're sort of at this crossroads. Which path do I take? But regardless of the path, the idea is to try to be sure that you feel valuable in your roles and you can be a contributor to that decision. So again, knowing that the reality is outsourcing is true, it is happening in the industry, let's have a better understanding or an introspective review, an insider's view of what outsourcing is. And as depicted on the screen, outsourcing really is a strategic use of outside resources that's going to perform activities that are traditionally performed internally by staff and using the resources of that organization. The next bullet that you see depicted on the screen is why people do outsource. And again, it's about a critical decision on what's going to make their product, customer service, and their deliverable of highest quality. And many decisions are made to outsource to be adaptable to the growing volume that organization or department may be receiving, to ensure the security, which can truly be done internally as well, and the efficient, while improving the overall service and reducing costs. So I think right here we're kind of pointing to areas or reasons why one would decide to outsource. If any of these areas of higher volume, inability to manage those functions, the information that's being managed is not being treated in a secure manner, and that we're not maximizing our efficiencies through our available databases that we have, or computer connections and programs that are available now in the industry. But let's first know about this. We want to help you, Dina and I. We want to help you understand the global view of what's happening in the industry. So let's look at our top 10 healthcare trends. And this is a reality. Mega mergers are going on every day between academic centers and smaller community centers. Academic centers that used to be more in metropolitan areas are crawling into mergers and acquisitions in the smaller community settings. So understanding that mergers are a thing, and we as enrollment specialists and credentialing specialists, we have to be able to adapt and learn how to handle the increasing volume of our work. The second healthcare trend is the reality, right? That drug prices are going up, deductibles are going up, regulations and the role that the government and states are having on how we perform our business every day is true, and it's becoming almost strangling is the word that I hear come from physicians. So while everything else seems to be going up, reimbursements are falling, and that's another reason why costs are being considered from a bundling perspective. How can we package our expenses to bring them to our clients or our patients in a more affordable manner? There's a growing increase of care at your fingertips. Just think around how we're managing our day-to-day business, not only from our work settings, but even in our personal lives, how access to things are so much more instantaneous than even just a year ago. Virtual healthcare delivery apps on smart devices are a growing trend, and they're going to continue to increase, which in many respects is good, because the electronic medical record, using that as an example, is in its very early stages of how it can really be used to maximize the efficiency of all of the practitioners. For those of you who are currently or recently have gone through an electronic medical record merger, you know, or implementation, you know the burden that that is placing on the hospital from a financial perspective, but all of the operating hospital departments, physician offices, and the impact that it's having on the clinicians. Cybersecurity. There's an increasing expense that is being realized to prevent against hackers for businesses. And here we hear at least once a month a business that has had their records hacked and credit card information of us, the public, has been made available to it. So it really is important that we recognize this is again going to be a growing trend, because they're just really in the reality, there are bad people out there trying to hack into our information. Another trend for healthcare is that we as businesses, as managers of our practices, we are being put upon and expected to be innovative, looking at new ways that we're going to bring our costs under control so our healthcare organizations can focus more on the delivery of a quality product at the lowest possible cost to their consumers and patients. Another trend is behavioral health is moving to the forefront, and that's a great thing, because we know that many of the expenditures happening in our society are based upon the lack of attention behavior medicine has had over the last number of years. Care is moving to the community, as I had mentioned about the mergers and acquisitions and the increase in that. Our academic centers are moving into community hospitals and managing those as well. There's new data that's being collected on from these high-tech databases that will truly work to improve patient care and the outcomes of patient care. Many of the points of feedback that I get from these healthcare organizations, hospital presidents, board of directors, the chair people for the board of directors, and physicians are saying that there's just not enough data there to prove that this electronic medical record was really an improvement. Now, You may have internal data that substantiates the care that you're providing has been improved, and that's good. But from a global perspective, we know we're working towards that, but just not enough to kind of turn that key for physicians to really jump on board with these things. And many physicians, whether they're more senior physicians or the newer physicians, of course, the newer physicians adapt usually more easily to the digital environment, but more and more physicians are having to communicate in that electronic world, and much more amicable to be educated in those areas. Another healthcare trend is really the development that's being used in medicine that can only be generated from living organisms. This number 9 one really interested me, because it seems like, wow, what advances could that have, or the impact it could have on healthcare with regards to disabled people with Down syndrome. I mean, it's sort of the sky's the limit on what the possibility of this type of medicine could produce for us in America. And then our last top 10, excuse me so much, our last top 10 healthcare trend has to do with money. And we know in enrollment, right, it's all about the money. Excuse me, the more quickly we can get our practitioners enrolled into the health plans, get them credentialed, get them onboarded, the more advantageous it is for that health plan, as well as to the organization in which they're going to practice. But as I said, the sophistication of that electronic medical record and many of the platforms that organizations are using, they just haven't really hit their stride in being able to utilize all of the information that's being collected in a way that produces that value back to all of the stakeholders, which includes, as number one, the patients and the physicians. So really, really wanting to move whatever our practices are going to be to value-based services. And that's really goes in line with our next visual for you. And it's about you, enrollment specialists, you, MSP and credentialing specialists. How can the information that Dina and I have been presenting in this webinar series truly translate value to you, that you are making a difference, and to your organizations? And that's what Dina and I have been attempting to do, to help you make that difference in your organization. And it all starts first by attending these types of programs, having a working knowledge of what's happening out there in the world, and then applying it in real time to your practices or your organization. So really, let's focus down a little bit more in detail about outsourcing that directly is impacting perhaps some of the work that you're currently doing. So looking at credentialing, I know, just based upon the requests that I get from organizations, and it's varied organizations, it's not just hospitals, it's not just medical staff services departments, it's not credentialing verification organizations or managed care plans, it's across the board, physicians' offices, as well as software companies, et cetera, credentialing, which used to be a very dependent process to be performed in a hospital setting or in a work environment, has really exploded into a remote work environment. And I think that that's perhaps not new information, but just know that outsourcing those tasks to be done from a verification standpoint to remote sources is a value add if it's possible to adapt for your work environment. Relating to payer enrollment, I would really love to ask Dina to relate any experiences she has pertaining to her consulting role within the payer enrollment field.
Thank you, Donna. The payer enrollment area is a huge area where outsourcing has become increasingly popular from what I've seen. I think with the advances in technology that are out there and available, that it's much easier to be able to entrust some of those functions to another organization. And personally in my own business, I've seen a huge increase over the last 5 years that I've had my business in the number of organizations that are coming to me and wanting help outsourcing their enrollment function, or even just I've had companies call me just to ask questions about the process, about just different advantages, time zone advantages. I mean, there's pros and cons. Definitely that I think organizations are looking to more and more to get more information on. So I've definitely just to sort of concur and agree with everything that what Donna said. Just the trend in outsourcing that I've seen in the payer enrollment function is definitely an area that I think is thriving right now, as well as credentialing. I do get a lot of requests for referrals for a lot of the areas that we're talking about. So it's just which I find really interesting. It just really means to me and solidifies to me that companies are struggling with everything, all of the cost associated challenges that Donna explained earlier, that they're really trying to come up with some more cost-effective solutions to offset their business. So if we could go to the next bullet, I think Donna could speak a little bit better about the interim staffing and support services function.
Sure, I'm happy to do that, Dina. And it gave my voice a chance to rest, so thank you. Relative to interim or locum tenens, for those of us working in healthcare, we know that the frequency by us receiving applications that we have to verify and process from locum tenens practitioners is increasing as well. And so the opportunities of utilizing these sources because of the shortage of physicians, because of the shortage of PA and the growing, increasing number of patient cases and patient loads and patients' admissions. So organizations are having to look outside of their traditional roles on utilizing exclusively internal folks to backfill any voids that they would have in service lines. Billing and coding, again, used to be a function that would be performed in-house, and now, because of the remoteness, likability of those two functions, can certainly be done remotely. Medical transcription is another one, especially with the electronic medical record. The need to have on-site HIM, health information management professionals, be maintained in the medical record department or in that HIM department is decreasing, and more of their staff are going to a remote work setup. And then, of course, IT systems and management. We are reaching out, just as credentialing and enrollment specialists, we are reaching out to folks like symplr and IntelliSoft and Morrissey. All of the key credentialing softwares have also adapted software that can be utilized for enrollment. And so you really want to be able to critically look at the proper software companies to be sure that they're matching your needs. And with that goes along, again, with that medical billing and the revenue cycle software. They now have software dedicated to that. And always reaching out relative to IT management. More and more of their workers, are not on site any longer. We're having to call a help desk in order to get our tickets services serviced. So we know that that's truly a reality that we're all having to live with, or at least we know someone who has that experience. As we're moving on then, looking at the trends that are happening with regards to outsourcing, Dina, you want to take the next, how about if you take all of the issues on this slide and I'll interject as I need to, please.
Okay, let's definitely give your voice a well-needed break. Well, when I was doing research to help come up with this program, it was really interesting finding what the trends were in outsourcing. And as you can see, that's demonstrated by the need for controlling costs. Companies absolutely need to maintain quality and quantity and at less cost. So that's one of the most important trends. That ties in with the finances are becoming tighter in health systems. Another trend is the use of IT-based systems. They're becoming a necessity, similar to what Donna was saying about the need for medical records, electronic medical records, larger databases, information collecting regarding patient care and analytics. Just the use of and the costs associated with those systems becoming a necessity. Health systems are needing to maximize operational efficiencies, time efficiencies for management and staff, maximizing the knowledge and utilization of their resources, and then also doing all of this while minimizing and controlling operational costs.
And so there we go with the dollars again, right, Dina?
Absolutely. It all comes down to dollars in our, dollars in patient care in our industry. We are looking at, there are a wide variety of outsourcing options that we've discovered. There are websites that are designed specifically for outsourcing. So there are actual organizations or websites or companies that can connect you directly. They can connect your organization directly with a consultant or a consulting company, an outsourced company. Those companies can assess the needs of the organization and actually screen the consultants, the people who are doing the outsourced work. And they can also, those types of choices or options can also help provide on-demand services. And going into the different areas of outsourcing, there are specific options that are also in wide variety of billing, credentialing, revenue cycle management, and also software to help facilitate those processes.
Keep on it going, Dina.
Also, we found that the available technology creates an outsource-friendly environment for companies and consultants. So there's a wide variety of web-based conferencing tools similar to what we're using now. There's teleconferencing, video conferencing available, screen sharing, online document sharing and storage tools. All of these are resources that make it much easier to outsource, and it creates an outsource-friendly environment. Cloud-based software, such as credentialing software. There are many apps that can take care of most any task that we could think of, and they integrate across most smart devices. It just makes it very easy to and a friendly environment to be able to outsource. And another resource are real-time project management resources. So making it much easier for people to collaborate, keep track of who's in what part of the process, and who has ownership of certain tasks. So I know I found it in my own personal business. I use a number of different resources that help, that I find are very helpful in just conducting my day-to-day business. So looking at the dots and connecting what we've been talking about, what happens if the dots do not connect between these three functions, between payor enrollment, credentialing, and revenue? So there are repercussions that can happen if there's a disconnect between all three of these. Poor processes can cause unnecessary delays in processing times by companies and payors. So if information can't be verified quickly by the credentialing department and efficiently, the provider can't be enrolled as quickly, then the enrollment department function is not able to be completed. And then if obviously that ties into taking a little bit longer and causing delays when most payors already take a substantial amount of time to process applications. So that's something that can happen when there's a disconnect between the three. Also causing a lag in billing and reimbursements, because if your payors are not enrolled quickly, that obviously creates a lag time in collecting money. Longer delays in billing mean longer delays in revenue, and time is money.
There you go. Yes, there we go again.
Another repercussion of a disconnect is just having the wrong information. The wrong information can cause interrupted or delayed reimbursement, such as a wrong specialty, wrong forms used in enrollment. There are errors in billing and provider information that can create a disconnect and cause delays. Anything that might be expired that you might submit from a credentialing to a payor, that would cause delays. And expired documents, the lack of information, the lack of organization of information. So if there's a disconnect between different departments as far as who has what pieces of information, that information spread among those people and locations and department, if there's a disconnect between that, it can also obviously cause a delay. And then again, time equals money. So we want to make sure that there isn't a disconnect. And what we're speaking of can absolutely help with the flow. So going to the next slide, the importance. Maybe we can go to the next button. Sorry. Going back, the lack of the communication, absolutely that can cause delays, because there can be a lack of communication between departments, between leadership and staff. I've seen absolutely payors have a hard time communicating with us. I've seen challenges in communicating even with my clients, trying to get information from my clients between departments at the organizations where my clients are at. If there's a lack of communication, absolutely that can cause delays. And then the lack of expertise. If you've got a staff that doesn't quite know what they're doing, and as we all know, there's very limited training for our industry in credentialing and enrollment. So it's mostly, I've found that most of the education that I've received has been just based on my 15 years of experience in working with certain payors and certain provider types over and over again. So I kind of refer to that as tribal knowledge. And so it does take quite a bit of time to, and there are time to learn these nuances that are very specific to payors and agencies. And of course, the time equals money again.
Mm-hmm.
So,
and Dina, this next slide really does convey everything that you've just described for us, right? It's all interchangeable. So would you mind for our audience just reinforcing the reality of this visual?
Absolutely. Well, as we all can see, credentialing affects payor enrollment. The payor enrollment, timeliness, and efficiency processes affect your reimbursement, and reimbursement from payors affects the organization's revenue. So it's really kind of all ties together, that the need for not having a disconnect and making sure that functions flow seamlessly and efficiently.
And so that is why there is such a desire right now to focus on the collaboration among those three functions: credentialing, enrollment, and the reimbursement side, that revenue cycle. So much more in hospital settings I can address. You will see that there are even VP positions that have been made to sort of bring those functions together, so they're really talking with one another, sharing one source of truth, one software product, or multiple software products that will talk to one another to, again, maximize the efficiency of getting those practitioners onboarded, verifications of credentials, and the enrollment piece together and coordinated really, really well. And it has truly, when it works well, when I'm out in the field and you have a strong person leading those initiatives, it works well, and it's a beautiful, beautiful thing to see. Very artistic in a sense, but there is a science and strategy behind that. So Dina, would you mind taking our audience into the pros and cons of what outsourcing means to them?
Absolutely. Well, like you see here, there are always two sides to every coin. There are many different aspects to weigh, and I'd like to actually first start by going into the cons, potential cons of outsourcing, because nothing's ever perfect. So if your company decided to outsource, you could run into some risk of confidential data exposure. Maybe some companies and outside resources, they might not secure the data as well as your organization might. There are software tools that can help minimize that risk, but just keeping in mind that that might be a potential risk. The lack of process centralization. So external resources may be less reciprocal to share where they're at in the process, maybe what their processes might be. They may be actually not as centralized, depending on the organization and how well organized they are. The next bullet would be the...
Before you go to the next bullet, though, Dina, let me ask this question. A con of outsourcing is the lack of process centralization, just as you described. Is that something that can be written into the agreement that you would have with that outsourced source or vendor?
I would think so.
So the more we can delineate what our expectations are up front and hold those vendors accountable to that service that they're committing to providing.
Right. From my own experience, I'm more than willing to to accommodate requests from my clients. But I think in this particular bullet, it comes from a perspective of the organization not having, since they're outsourcing that component or that function, it means that it's not quite centralized within their own organization. So an external resource might be less reciprocal to share certain aspects. That was kind of where the con that I was speaking to. The next bullet would be just there could be a possibility of having control over a company's processes. It's real similar to the previous, but outside organizations typically have their own processes, and they might not match the organization. So that might be something to keep in mind. There could be a reduction in the synchronization of deliverables. So what I mean by this would be that, again, that an external resource might be less communicative. So you might get a little cross disconnect on who's doing what for a payer, because there are different processes, there are different functions, there are things that come in along the way that a payer might ask for as a deliverable, and it could be something that maybe the outsourced company doesn't have access to, so it has to come from the organization, and so there could be there could be a synchronization problem with the deliverables. Just keeping in mind that if you use an outsourced company to do that function, just to make sure that there's a full line of communication open. Communication challenges, very similar to the previous, just different organizations might have different preferred methods of how they like to handle their communication. Hidden costs might come into play for any additional time or resources that it might take for the outsourced project. Ability to follow standards upheld by the client. So this speaks to just keeping in mind that outside resources may have different values. They may not handle your client as well. Similar to the lack of focus, they may have a different way that they handle your organization. So just keeping in mind that those could be some challenges for outsourcing your enrollment or just outsourcing any function, really. So now some benefits and pros of outsourcing. Outsourcing can help your organization realize a revenue and enhanced return on investment because companies can get better use of employee time. Companies can use task-specific dedicated experts to carry out those outsourced functions. So when they do that, they're tapping into a specialty knowledge base that, like I said before, I consider it to be a lot of what we do as OJT or tribal knowledge that we get, because like I said, there's hardly any training available out there. So outsourcing can also help reduce operational costs, less equipment, furniture, office space, supplies. Those are all costs associated with keeping an employee in-house. That can also reduce employee-related costs associated with benefits such as medical, dental, sick time, vacation, employment taxes, and just the time that it takes to administrate employees as part of the organization versus outsourcing just typically requires signing an agreement and paying that company on as a vendor basis rather than going through a payroll. You can actually increase the centralization of process and information sometimes with outsourcing because it reduces the number of people in your organization that it takes to do a specific task. You can increase time efficiency because outsourcing can free management time and staff to focus on other core competencies and projects. Also, you can increase the speed and quality of deliverables because you've got another company who's focused on using experts that can increase productivity, and you can also sometimes get through in credentialing and enrollment. The more files you can get through quicker, the quicker the provider can be billable and generate revenue. There's also a higher probability of using external technology. So you're not a company might not be willing to let another company use their technology, thinking and remembering. And it means that your organization could actually use less infrastructure internally. So that would be less time and money spent on internal technology by using an outsourced technology solution. And there's also a broader availability of resources. As we've seen, there's a lot of different types of outsourcing available. And then lastly, time zone advantages. I know personally from experience that I am physically located in a time zone that's beneficial to some of my clients, where they can wake up and have some of their work done outside of their normal business hours. So that's a good benefit. So now looking at what we've covered and considering all of the factors and information that we've discussed, what can you and your organization do? Well, oh, go ahead, Donna.
Oh, I was going to say yes. You kind of teed that up perfectly, Dina, because what we've covered to this point in this program is understood about outsourcing. What truly does that mean? We covered healthcare outsourcing trends, so we see things from a big picture perspective of what activities happening out there. Then we narrowed that down and gave you specific examples of industry outsourcing trends that we may personally be experiencing, or we know of a colleague in a department near to us that is experiencing, and then gave you consideration points, because remember, this graphic that you see on the screen, it kind of reinforces the graphic at the beginning, just asking you all to think about it, right? To think about whether or not your processes are supporting the operational infrastructure and needs and desires of your clients, your patients, your customers, and your employees. And are you performing the work with good quality products and good outcomes? And if so, your internal options are the way to go. Knowing that external choices are there for you should there be a significant increase in volume, a changeover in staff, whatever those factors may be, but at least you're aware of the decision tree that lies before you as you continue on with your activities, and really be looking at things from a strategic perspective. So you might ask Dina and I then next, okay, so I understand the two pathways that are available. I understand the concepts and the trends that are happening out there. But Donna and Dina, can you give us, like, I don't know, the top 3 things or the top 4 or 5 things that we could do to really help us evaluate, is this outsourcing something that I should be considering? And that's really what we'd like to share with you now. It's really about the volume of work that is currently being managed by your staff. Are your staffing levels appropriate for the workload? If not, perhaps an assessment of workflow, staff competencies are needed, but also evaluating, is this a temporary increase that can be managed with the current staff, overtime, etc., or is it going to be a larger opportunity for you and your organization that you really need to be thinking again strategically? Another consideration point, it kind of ties into the volume. You have increasing work volume. You have staff that are being expected to perform that work, but what is the competence of the staff? You want to believe that they've been doing and managing your functions fine and appropriately. But again, every good business person has to at some point evaluate, kind of do an internal check. Are there things as an employer that I can be providing better tools for my enrollment specialists? Do they have the proper hardware and software products available to them to make their jobs most efficient? These webinars that Dina and I have been doing are indeed part of that, increasing the competence for enrollment specialists to help them kind of up their game, if you will, and making sure that the competency of staff really does address the timeliness of the product in which they're producing and the ultimate quality output of that product. Can the costs of staffing, can that cost ratio really be the best bang for your buck? And only you, as the operating manager or the owner of a business, are you able to make those determinations? Is it worth at least doing an analysis of what else is out there? It doesn't mean that you're going to carve away your entire department, but it means that at this point, it may be a factor that you would want to serve as a trigger on whether or not it's time that I at least start doing a little bit of investigation. And then the product integrity, as we mentioned, sort of in the quality and competence of staff, the integrity of the product that's being produced. Is it the correlation of staff? Is it the lack of tools? Is it insufficient staffing? And does that product integrity create an even greater risk of compliance, meeting the requirements of the various health plans, and making sure that internal policies and expectations are being met? And that is based upon what you know, what you hear from your stakeholders. Is there something amiss that the manager of that process, the owner of the company, or even someone doing the detail work of the enrollment piece, are there improvements in the functions in your practices that could have an impact to your business of operation? And then the number 5 piece is really, again, looking at strategically what business model are you wanting to embrace to truly optimize the experience for your enrollment specialists, for your credentialing specialists, for the efficiency, for the quality output, for the integrity of the product and the utilization of automation. So really be looking at what other things are out there and truly begin to integrate the projects that you know are coming into your business world. And so then it really, once you make that analysis, once you really look at your organization and how you're performing the work and that function with a critical eye, it's really time to think about creating a plan. Create your business plan by reaching out and asking for an assessment of your operation. Look at statistics across the country. Contact other colleagues who perhaps are serving as an enrollment specialist or as a manager or a director of a enrollment department, and find out what their turnaround time is, where they have found areas of breakdown or perhaps some improvements, and try to secure some statistics. Now, I want to pause there for a moment and ask Dina. Dina, are you aware of industry statistics specifically, like national statistics that would be available for our colleagues to tap into?
Well, I think that the most popular statistic as far it concerns timely processing of applications. I don't really have a national statistic, but I mean, from what I have a national reaching client base, and I deal with payers across the United States, and just the timeliness factor that payers typically take, I would say anywhere between 90 and 100 days at least to process applications. So
that would be a good starting point right there.
Knowing that's one sticking point that can help in creating your plan. If you're going to consider, if our listeners are considering outsourcing, that would be kind of where I would start as far as the processing time that it takes payers, and sort of maybe work backwards as far as what it takes in your organization, all those little processes, how long it takes to get information from providers, just kind of backtrack, and then you can come up with your own time frame.
Yes, and I think we've identified through our many webinars and educational servings that we've provided to the industry is that's where the industry is lacking. You know, it's difficult for one to go to one source and get all the training and education you need, or for you to be able to benchmark against a national standard, because at this point it just doesn't exist. But That's an opportunity. The more and more we can become educated in how we can perform more effectively, that kind of thing is certainly going to be coming around the corner for all of us, which will help indeed. Another part of the plan is to identify the key areas of projects that you would want to focus on. Dina gave a perfect example about the turnaround time. Are there specific health plans that create greater challenges? Are there consistent deficiencies that are left out of an application that might be tracked back to the performance of the enrollment specialist, which is a matter of fine-tuning and reinforcing needed training and education for that person. By evaluating all of the different outsourcing options based upon the projects that you think that you're needing assistance with, and focusing and doing your research and requesting information relating to that piece, and then producing your justification. Why is it that you think that you would be interested in doing some outsourcing business? You have to present to your administrators the value that you're bringing to them with this idea, and really have it well thought out about why it's in their advantage to do so. And again, every time one would hear that we're going to outsource, the natural anxiety by an MSP would be, oh my gosh, that means that my job is going to be eliminated. Please, I know that was a fear in the credentialing world as well when we began to outsource the verification piece from a hospital and into a CBO. There is the volume of work that's out there for us as enrollment and credentialing specialists. I really don't believe that that's going to be a real fear that one needs to kind of be consumed with. And then again, creating an impact analysis. By choosing to go in an outsourced direction, what benefits would you be bringing to that organization? And then presenting that plan to your executive team to get their endorsement. Have them push back. Maybe you need to do a little bit more research in a couple of areas, but at least, again, you're presenting your value plan because you've thought the thing through. And then also the impact it could have on that organization by doing nothing. Will it negatively impact your current client and your current practitioner base if you do nothing? If you make no changes in your current process, perhaps by just looking at this from an analysis standpoint, maybe it would mean that you'd need to hire some additional internal staff. But if really the bigger picture is looking at all of the pieces that are going to help you make your decisions as you work through this process, this thought process. And with thinking through the thought process, Dina and I kind of want to leave this particular program with this thought in mind. If we never try something, if we don't pursue it, we just never know. But if you're willing to think about it, if you're willing to give something new a try, even a new idea, it doesn't mean at this point you would even have to act on any of the information that Dina and I shared. But if you're willing to take one small step, as this graphic so well stated by Dr. Seuss conveys, the places that you'll go, because we never know what's around the corner for us except opportunity to do even better. And so with that, I'd like to turn the program over to Callie and the symplr folks, please.
Thank you so much, ma'am. Does this video clip play for you?
It does not, unfortunately. I'm sorry, but hit it, Callie.
All right, not a problem. And now a word from us at symplr. We wanted to let you know that we do have a payor enrollment option that symplr does offer for you to outsource your enrollment. We have a dedicated team of specialists that process all of the necessary items to get your payers enrolled. If this sounds like something that could benefit your facility, please reach out to us at sales@symplr.com. Again, y'all will be receiving the archive of this webcast and the slides to download in an email with next week, more than likely. Please keep that in mind, and to make sure that you get it, add communications@symplr.com to your address book. Also, you will have the contact information for both of our wonderful speakers whenever you download the slides. Ladies, that's about all the time we have today. I didn't have any questions roll in. Would y'all like to say anything in closing to our audience?
No, just this is Donna, and yes, I shouldn't say no. I'll say yes. This is Donna. I would love to say thank you again for your great participation, as always, through your attendance. This closes up our payer enrollment educational topics for this year with symplr, but the collaboration, I'm sure, will continue into 2017. Dina, how about you?
Well, I'd just like to thank everybody for tuning in, and hope that that everyone has learned something to take away to their organization.
I know it's a lot to think about, isn't it?
Well, it's a good thing to think about, because if a company has a little bit of challenges in getting things done, hopefully this will help.
Yes, exactly. All right. Well, thank you, Callie. Thank you to our listeners, and we'll talk to you next time. Bye-bye.
All right. Thank you so much, everyone. Have a great day.